All right, welcome back. It's called a growing epidemic in this country, and for good reason. According to the Skin Cancer Foundation, 9,500 people are diagnosed with skin cancer every day. More than 2 people die of the disease every hour. Sobering statistics, right? But the good news is when detected early, the 5-year survival rate for melanoma is 99%. That hits close to home because in June, my wife became concerned about a spot on my face and urged me to make an appointment. Finally, she made that appointment for me. The doctor found a spot, did some tests. Then I went back to the office and they took out the rest of the spot, stitched me back up. Fast forward to that right there. So now Dr. Rachel Hailey is here. She's a board certified physician with HCA Midwest Health to discuss the signs of skin cancer. And Dr. Hailey, as a family medicine physician, you're often the first person to see maybe something suspicious that might need to be checked out by a dermatologist. So what are some of those signs that people should be aware of that maybe could lead to skin cancer down the line?
Well, Bill, let me say, I'm so glad your wife made you go get that checked out, because it's easy just to blow these off as normal age-related skin changes.
I mean, honestly, I'm 42 years old. I've never been to a dermatologist before a day in my life, but you know, she goes regularly, and she was like, Bill, I really want you to go take that look at it. So here's the other lesson you learn in this is husbands, listen to your wives about stuff like this.
Smart woman. But you know, early detection of cancerous lesions and even precancerous lesions is so important. It's key to preventing devastating spread of some types of skin cancer and even death. And you know, the key to detecting skin cancer early is regularly examine your skin. Look for new skin growths or changes in current ones. Things to be concerned about is a sore that's not healing after several weeks, or changes in moles, including its size, shape, color, the presence of bleeding, itching, or even tenderness. And really, any skin lesion that looks different than your background skin or an area that's scaly or patchy, these warrant visits to your healthcare provider or dermatologist.
Yeah, it's nothing to be scared of. They just go over and look all over you, and they'll give you their best diagnosis. But for me, when they sent this sample off, it came back as inconclusive, so they had to send it to a separate testing site, and then it came back as I guess there's 3 rating periods, you know, low risk, medium risk, and high risk, and this was a medium concern, so that put me back into the operating chair to get it taken off, right? But I mean, I was outside as a kid a whole bunch, you know, playing baseball, riding my bike. I didn't like sunbathe or anything like that, and I can't remember if I put on suntan lotion. I mean, that was 40 years ago. Let's calm down now. But what are some of the most common myths about skin cancer?
Yeah, that's a great question, and some of the myths that surround skin cancer that have been debunked by research include, you know, just kind of what you mentioned. I don't go outside. I'm not at risk for skin cancer. Unfortunately, that's false. You know, even brief exposures over time can accumulate skin damage and lead to not only wrinkles but skin cancer. So it's important. I remind my patients, make sunblock part of your normal everyday routine. You know, another myth is that tanning beds are safer than the sun's rays, and this isn't true. You know, UV exposure to, you know, from tanning beds can lead to wrinkles and skin cancer as well. In fact, getting in a tanning bed before the age of 20 can increase your risk of melanoma by almost 50%.
Oh man, that's crazy. And those were all over the place. I mean, I don't think we see them as much anymore, but still, they were all over the place back in the day. I know a lot of folks that spent a lot of time inside of those beds. But let's talk a little bit more about some of the different types of skin cancer. I know we've talked melanoma, but are there other types?
We divide skin cancer into melanoma and non-melanoma cancers. You know, melanoma is the most serious form of cancer, 75% of deaths, and there's going to be an estimated 200,000 deaths from melanoma this year alone. But the other types, the non-melanoma, 90% are caused by the association of UV rays. And these include basal cell and squamous cell. Basal cell most important, or most common, 3.6 million cases every year in the U.S., and squamous cell 1.6 million every year.
Well, really quickly, only got about 30 seconds left, but what are some of the treatments that are available in the Kansas City region for skin cancer?
The first is to get screened, and Sarah Cannon Cancer Center at HCA Midwest Health, we have the doctors and the tools to diagnose and treat all forms of skin cancer, and our comprehensive network has research nationally to treat even the most advanced forms. But most importantly, early detection, wear your sunblock, and get screened.
All right, good advice there. Thank you so much for your time, Dr. Hailey. We do appreciate it. And for everybody who wrote in asking what was on my face there, now you know. All right, for more information about skin cancer, head to hcamidwest.com. There you can find a doctor as well as the closest ER and urgent care near you.